Good morning, everyone. My name is Selena Hodge, and I am the Executive Vice President of Temple University Hospital Allied Health Professionals. And I have the pleasure of announcing this morning my president, Carlos Aviles, for the Temple University Hospital Allied Health Professionals. Carlos is our proud leader. He stands beside us. He stands beside all politicians that fight for this hospital. And he is one of the proudest presidents I have ever had the pleasure to work beside here at Temple. And I want you right this second. When I say union, I need you to say proud. Union? Proud. Union? Proud. When I say union, you say? Proud. Union? My president is one of the proudest presidents I have ever stood beside, and he is union strong all the time. Carlos Aviles.
Thank you, everyone. Appreciate it. My name is Carlos Aviles, and I am the standing and, as said by our Executive Vice President, proud president of the Texas Pros here at Temple University Hospital. And I stand here today on a very proud day because I actually get to endorse and talk about the only candidate that have fighted with Temple for years in and out. The person we are going to be endorsing today is not a politician that stands behind propaganda. Is not a politician that is running on things they don't know. Let's go back to COVID. Let's go back to when this hospital was struggling to take care of patients. Let's go back when the front line was struggling for PPEs. We called City Hall, we called everybody, the governor, we called the mayor, we called our congressmen, we called our state reps. Guess who was the first person who showed up? Sharif Street. Guess who was the only person that is sure day in and day out that we got the proper PPEs to support the front line here? Then let's go back to recently all the contracts, all the issues with the front line, short staffing, all the issues to patient safety, to staff safety. Where we make a call, who shows up? Who pickets the front line with the healthcare professionals? Who stands with the community and the patients that we are so proud to take care of? Who fights for this community and for all unions, not just at Temple, save lives and put their own lives in jeopardy every day they show up? So without being long-winded and without having to express a lot of falsehoods as a lot of the other candidates have, I just want to say there's only one candidate that is for the people. There is only one candidate that knows what the people need. There is only one candidate that's going to go to Congress and not be brought out by corporate politics. There's not going to be a person going to Congress claiming to be a physician, but being so outdated with what the people need and want today. And I have to say this because I'm passionate about what I do, and it's an honor and a privilege to finally represent somebody that represents me, represents these people, represents our community. I stand with the only candidate that fights with us every circumstance, every contract, every issue. I stand with the only choice that represents the people and the community we serve. And to quote a great man, since we're endorsing a great man, it's like Malcolm X once said, a man that stands for nothing lays down for everything. Think about that when you're going to vote. Think about that when you're going to endorse somebody who's either going to be for the corporations or somebody that's going to be right here today, a person who's been here for over 10 years. Every contract, every issue, every pandemic, every crisis. The only choice we have, and that is Sharif Street. So I just want everybody to understand we can't do what we did last election A no vote and a vote for incompetence will put somebody else in office that will help destroy healthcare, help take away everything we fought for and everything we still have to survive for the next 3 years in this presidency. So with that being said, I need everybody to just do your research. Talk to the people, talk to the community, talk to the people that are impacted. Because every other candidate here is spilling a lot of propaganda. What I'm here to do is to endorse the people's choice. The only choice that stands with us day in and day out. And as my executive vice president said, I am passionate, I do fight. But every time I'm fighting and I'm marching here, there's only one state representative that comes the second we give a call and is fighting right here with me, marching on every issue, every day, making sure that we are protected and we are properly represented. So people, please wake up. There's only one clear choice here, and that's the people's choice. Make sure you pay attention. Make sure when you go and vote, the choice is clear. There's only one person that's going to go to Congress and represent our issues. There's only one person that speaks to the people and knows what we need. And that person is Sharif Streak. So right now I want to hand the mic over to the president of 1199, another strong representative of a fighting union, Ms. Dion Gray.
Gary.
I apologize, Ms. Dion Gary.
Good morning. Let me put this down a little bit, right? Good morning.
Good morning.
I'm a little short, tall. Good morning. I am Dion Gary, the proud president of District 1199C. I stand flying to Philadelphia, whether providing direct patient care or the vital support services that keep our healthcare institutions running. As such, healthcare workers have a unique vantage point into the lives of people we care for every day. We see the very real impact of the recent cuts to healthcare funding, from the reduction to public health support to the greater administrative burden placed on our healthcare institutions. We know so many of our folks are suffering due to the massive cuts in Medicare and Medicaid from the current administration, from little babies to the elderly, including the working class Philadelphians. Families are struggling to put food on the table and meet the basic necessities in their everyday lives, and yet to see more attention given to starting wars and chasing down our neighbors than helping reduce daily burdens that impact our community members, including the 8,500 workers that I represent. That's why we demand a fighter in Washington, and that's why District 1199C proudly endorsed Senator Sharif Streak for Congress, the only person for the folk, for the people's choice. He is committed to healthcare workers. He listens to us. He helped us secure funds for training our workers. He walked picket lines beside us and advocated for us in Harrisburg for safe staffing ratios, fair contracts, access to care. We know with Senator Street in Washington, we have a real friend in organized labor and healthcare. He has the legislative experience to turn demands into law and will stand up to Trump on day one. He is the only candidate that is ready to step up day one. And I get the distinct privilege to introduce the next congressman in Washington, Senator Sharif Streak.
One, I want to thank you all for the work that you do each and every day. You all do the work to take care of people. You do the work that makes, when families come in and they want to know what's going on with their loved ones, you're the first point of contact. When people come in off the streets and they are literally, in some cases dying, and in some cases don't know what's going on with them, you're the ones that provide care. You are the frontline workers, the direct care workers. And I will always stand with you in whatever capacity, whatever strength the good Lord gives me. I'm honored to work for your endorsement, and I appreciate what it means to our community and what you mean to our community. I recognize that you get up every day and your number one priority is taking care of your patients. Gun violence and the homicide rate, at one point, the number of shootings in Philadelphia was rising. but because of the care that you delivered here at Temple, and because of the care that emergency rooms across Pennsylvania were providing, the actual homicide rate dropped even though the number of shootings was increasing. The homicide rate was dropping because you wouldn't let people die, because you pulled the bullets out of them, you patched them up correctly. I was proud during COVID to make sure that I stood with you, to make sure you got the PPE. I was proud to be out here with you to make sure you had the things you needed. I was proud to stand with you when we made sure we secured resources for hospitals because high Medicaid utilization hospitals were underfunded and you weren't able to get what you needed. But after we secured that funding, I needed those hospitals to understand that we didn't give the money so it could go to just executives. It needed to go to the people who were on the ground. And I know that you're still chronically underfunded. And although there may be other candidates that don't agree with that, when you work in a place where where most of the patients are dependent on Medicaid and Medicare, and Medicaid's only paying 62 cents on the dollar, it's not enough. And I will fight to reverse those cuts. I will fight to make sure that you get the resources. I know that you see people, no matter whether they have resources or not, but the Pennsylvania Healthcare Exchange I was proud to work to get that passed. I was proud to be a prime sponsor, because you're going to treat people when they come to you. But it's better that they come to you for preventive care and they don't just show up in the emergency room when they're having a crisis because they couldn't get preventive care. And the Obamacare tax credits are reversed so we can keep pennies strong. And I will tell you that I am proud to be endorsed by the folks who are not just talking about health care, but deliver it best. And for those who are out there that want to know who in this campaign, who running in this race most understands how healthcare is delivered, it's not just a slogan for me. It's not just a slogan for you. It is working with the people who deliver the care now. And I know that there are some candidates that say we can't do anything unless we get everything. But you know that you got to, every day there will be people here who show up that need your help. And I'm going to get you everything that I can possibly get you today and fight to get you more tomorrow. Because that's what you do for your patients, and that is what I will do. Barack Obama called it the fierce urgency of now. You all say, Michelle Obama said just do something. You all say, we need help right now, Sharif. Because our patients need us now. And I want you to know help is on the way. I've been with you as a member of the state Senate. I'm proud to stand with you as a candidate for Congress and as a member of Congress. Together we will fight to make sure we increase the quality of care for every person that walks into our hospitals, not only here in this city but across our country. And we will fight to make sure the people who deliver the care can also feed their families, have safe staffing levels, and make sure that the most vulnerable among us are protected, because you have what you need to do what you need. God bless you. Thank you.
So at this time, I would like to introduce one of our champions in the hospital, our president of the nurses, Temple University Nurses Association, Marty Harrison.
Hi, everybody. It's a great day to be out here, a great day to be sending Sharif Street off to Washington. We hate to lose him in Harrisburg for all the reasons that he just said, but I think everything that he just said should give us confidence that he understands the issue. He understands this institution. He understands how healthcare funding works. And we will be here. It is true, we will be here to take care of patients, whether they can pay or not. But without reversing those Medicaid cuts, there will not be enough of us to do that well. There will not be the staff, the supplies, the equipment to do that, to actually reduce that homicide rate, to keep those people alive every day that we come to work. And that record should show you, and everything that everyone said before me should demonstrate why we have confidence that Sharif Street is the man to go to Washington reverse those cuts, and work to make this a better system that works for every Philadelphian. Your health should not depend on your zip code. We all need health care. Go for it.
Okay, group photo first. All right, we're going to do the group photo today. One, we all know that we endorse Senator Street for Congress, not because he's running, because he's always been here. He is not new to this. He is true to this. We all know what we say. We all know how we feel. We all know that when the cameras are not around, Senator Street is there, 5 o'clock in the morning, 11 o'clock at night. Senator Street is there with us all the time. That's one. So always remember to tell every single individual to get out and vote on May 19th. 2, on May 16th, my glorious birthday. Hey, wonderful things happen on my birthday. You know, Krasner got elected on my birthday. Let's just say wonderful things happen on my birthday. 2, we have to make sure that everybody signs up for the canvas. We're doing a large canvas on May 16th, Saturday, May 16th. We have a sign-up sheet. Nafis is the man. He has the sign-up sheet. We are ready to get this started. This will be our 3rd canvas. We are passed out here for Senator Street. We are attacking the Germantown area. We are attacking the Northwest Corridor because we are union proud. So we are getting out there and we are signing up. The other thing is, our chant going out of here today is, when I say street, you say Congress. When I say street, you say Congress. Street. Congress. Street. Congress. When I say street, you say Congress. Street. Congress. Street. Congress. Look at the retirees come out here and fight with us. All right, a legend. This is a legend out here. So you know that he's going to Congress. We got legends out here pushing this. So one more time. When I say street, you say Congress. Street. Congress. Street. Congress. Street. Congress. Enough said. Let's drop the mic.